Good afternoon. My name is Reshmie Ramautarsing, and I work at the Institute of HIV Research and Innovation, or IHRI, in Bangkok, Thailand. And today I would like to share with you some preliminary results of a study that we're conducting on anal HPV infection and anal intraepithelial neoplasia in Thai men who have sex with men with acute HIV infection. So compared to HIV negative MSM, HIV positive MSM have higher anal HPV prevalence. They're more likely to have infection with multiple HPV types, and they're more likely to have persistent HPV infection, particularly with high-risk HPV types. They also have a high incidence of anal cancer, which is up to 5 times higher than has been reported for HIV negative MSM. There are currently no data on the potential effect of early diagnosis and treatment of HIV on incidence and persistence of HPV or on the development of anal HSIL. So we conducted a longitudinal observational study of these things among HIV positive Thai MSM who initiate ART during acute HIV infection. So since 2009, we've established a cohort of acute HIV infection in which acutely infected Thai MSM are enrolled, which is called the SEARCH-010 or RV254 study. People are enrolled if they're in phoebic stages 1 to 5. Everyone is offered immediate ART and are routinely followed up every 12 weeks. So since the beginning of the study, we have 656 people enrolled, with almost everyone accepting immediate ART and 98% viral suppression. So in the current study, we're enrolling anyone who's enrolled in the acute cohort is 18 years or older and has accepted ART. And as part of the study, we're conducting visits every 24 weeks with digital anal exam, anal HPV testing and cytology, high-resolution anoscopy with biopsy of suspicious lesions, and treatment of neoplasia and observation if HSIL is detected. So of the target 100 people, we have enrolled 96. The total follow-up duration of the study is 192 weeks and is ongoing. And so far, the baseline results show that the median age of those enrolled was 26, 92% were MSM or bisexual, 4% were transgender women, almost everyone was single and employed, and 61% had bachelor's degree or higher. So here I'm going to show you 3 things. The first is the prevalence of anal HSIL by histology. The second is the prevalence of any anal HPV infection. And the third is the prevalence of anal high-risk HPV infection. So I'm showing you this for 3 groups. The first of which is for MSM with acute HIV infection. So that's the current cohort. And then we have 2 control groups from historical cohorts, the first of which is for MSM with chronic HIV infection, and the second is HIV uninfected MSM. So among MSM with acute HIV infection, we have seen 12% prevalence of anal HSIL, 76% prevalence of any anal HPV infection, and 63% prevalence of high-risk anal HPV infection. So to summarize MSM who have acute HIV infection had higher anal high-risk HPV prevalence than MSM with chronic HIV or even without HIV. They had lower anal HSIL prevalence than MSM with chronic HIV infection, but comparable anal HSIL prevalence as HIV uninfected MSM. So the follow-up for this study is ongoing, and with the data that we're collecting, we're hoping to be able to assess incidence and persistence of HPV in this cohort, as well as the incidence of anal HSIL. And because we're not treating HSIL, but observing it every 24 weeks, this allows us also to assess the natural history of anal HSIL in this population. Thank you very much, and these are my acknowledgements.